Hi, my name is Emma Campbell. I'm a student nurse here at USA, and I'm going to be doing my medication administration checkoff. I'm going to go ahead and show you my ID, and then we're going to go ahead and scan the room. Alright, so first I'm going to start off by saying that whenever doing this medication administration, you want to be in a no interruption zone. You want to make sure in the medication room the door is shut. You're not going to be taking any phone calls, and you're going to limit conversation with colleagues to essential information only. We're going to be following the hospital's no interruption zone policy. So now I'm going to go ahead and compare my MAR to my order form. I'm going to go ahead and show you both of those. Alright. So I'm going to go ahead and confirm that everything matches up. So we've got Jaguar Jones. MRN is 4176352. 4176352. They're allergic to penicillin. All right, we're going to go ahead and verify the medication. So heparin, the dose 5,000 units. The route subcutaneously. The time every 12 hours. And we're going to verify the right indication as well. So the indication for heparin is to prevent blood clots, DVT, which is deep vein thrombosis, or any type of venous blockage. And we would also verify that we have all the correct documentation here to complete a legal prescription. So now I'm going to go ahead and move my order out of the way. I'm going to perform hand hygiene. And now I'm going to begin my first check of the 7 rights. So I'm going to verify that I have the right patient. Jaguar Jones, MRN is 4176352. The patient's allergic to penicillin. I'm going to verify the medication, which is heparin, and I've got my heparin right here. The expiration date is 12/5/2025. I'm going to go ahead and show you the vial. All right. I'm going to verify the dose, which is 5,000 units. As you saw on the vial, we've got 10,000 units per every milliliter. So to calculate the dose, we would see that 5,000 units is going to be 0.5 milliliters, and that's the correct dose for this patient. We're going to see that the right route is subcutaneously. So right here we have got our TB syringe. This TB syringe has a 28 gauge needle that's a half-inch long. Typically for heparin though, to administer, we would use a 25 to 27 gauge needle. And I'm going to go ahead and show you this TB syringe now. Alright. I'm going to verify that we have the correct time. That's going to be every 12 hours, and it has been 12 hours. We're going to verify the right indication, which would be to prevent blood clots, DVT, or any venous blockage. And we're also going to verify that we have all the components here for a legal prescription. Now I'm going to go ahead and move on to preparing the medication. So I'm going to open up an alcohol swab, and I'm going to clean the lid of my vial. I'm going to go ahead and take my syringe, and I'm going to pull 0.5 milliliters of air into it. I'm going to go ahead and uncap it. And I'm going to push the air into the vial. I'm going to pull this up and draw the medication into the vial. And make sure you don't have any air bubbles. All right. I'm going to go ahead and put the safety up, and then I'm going to verify this dose again. So 5,000 units of heparin, As we saw in our vial, 10,000 units per 1 milliliter. So we would calculate the dosage to be at 0.5 milliliters. I would also verify this dosage with another nurse. I'm going to go ahead and show it to the camera. All right, perfect. So now I'm going to go ahead and begin the second check of the 7 rights. So while I do this, I'm also going to prepare my label for the medication. Right, so I'm going to verify the right patient. Patient's name is Jaguar Jones, so I'm going to write that on our label. The MRN is 4176352. The patient is allergic to penicillin. Next, we are going to verify the right medication. So we've got heparin ordered for the patient, and we have our heparin vial right here. I'm going to compare that with the MAR. Next, we're going to verify our right dose, which is 5,000 units, which will be 0.5 milliliters as we previously described, we calculated. So I'm going to go ahead and hold the syringe up to the MAR to verify the volume in the syringe. And we're going to go ahead and write the medication as well as the correct dose onto the label. Right, I'll finish with that, and I'm going to go ahead and show this label to the camera. All right, so now that I have verified the right patient, the right medication, the right dose, I'm going to go ahead and verify the right route, which is subcutaneous, and that's why we've got our TB syringe with our TB needle right here. The right time is every 12 hours, and it has been 12 hours. The right indication is to prevent blood clots, DVT, or any venous blockage. And we've got all the right documentation here for a legal prescription. So now what I'm going to go ahead and do is I'm going to take my prepared medication, my medication vial, and my MAR, and we're gonna bring this to the patient room. Go ahead and set all this down. So first I'm going to start off with performing hand hygiene once again. I'm going to lift the patient's bed up to a comfortable working height. I'm going to go ahead and put down that guardrail, and I'm going to begin to verify my patient. So I see the patient is Jaguar Jones. I'm going to compare that with the visible armbands. Jaguar Jones. The MRN is 4176352. 4176352, and the patient is allergic to penicillin. I'm going to verify that with the allergy armband, penicillin, and I would ask the patient if they have any other allergies that we would need to know. I would also perform any indicated pre-assessments for the patient at this time. Next, I am going to go ahead and explain the rest of the 7 rights. So I'm going to verify that the medication for this patient is heparin. We've got heparin right here on the MAR, heparin on our label, and our heparin vial right here. We have got 5,000 units 5,000 units. And as we previously explained with the vial, we calculated the dosage out to be 0.5 milliliters. When verifying the correct patient, I also want to check and make sure that I've got the correct name on the label of the medication administered as well. And after that, I want to verify that I have the correct time every 12 hours. It has been 12 hours. We've got the right route, which is subcutaneously, and that's why we've got our TV syringe here with a 28 gauge half-inch needle, even though we would typically use a 25 to 27 gauge needle. Now we're going to check and make sure we've got the right indication, and the right indication is preventing blood clots, DVT, and any venous blockages. And we've got all the right documentation here for a legal prescription. Now I'm going to go ahead and explain the procedure to the patient. Hi, Mr. Jones. I'm Emma Campbell. I'm a student nurse here at USA. I've gone ahead and looked at your pre-assessment and everything looks awesome, so we're going to go ahead and get started with your heparin administration. I'm going to go ahead and don my clean gloves. I'm going to put on my goggles. And typically this is where I would, since I'm choosing the abdominal site to inject the heparin, I would bring down the patient's bedding and slightly lift their gown, allowing for as much privacy as possible. So with the abdominal site, you do want to stay 2 inches away from the umbilicus. So I will be administering this medication 2 inches to the right or left of the umbilicus. I'm going to go ahead and grab my alcohol prep pad. I'm going to rip that open, and I'm going to clean the administration site. I'm going to clean from the center, going outwards, and I'm going to go ahead and leave the alcohol pad here. I'm now going to grab my medication. I'm going to move down the safety. I'm going to pinch 1 inch of the patient's skin and administer this medication at a 45-degree angle. And I'm going to push the medication through slowly. With heparin, you typically want to administer this medication over 30 seconds. I'm also wanting to make sure not to aspirate due to this medication being a subcutaneous medication. So now I'm going to go ahead and apply some pressure with my alcohol pad, and I'm going to dispose of my needle into the sharps container. After I have applied some pressure, I'm going to make sure not to massage the site. I am going to check and make sure that there are no adverse or allergic reactions to this medication. I'm going to lift the patient bed back up, or I'm going to move the patient's bed down since it was already up. I'm going to lift back up that side rail, and I would also position the patient for comfort. I'm going to take off my clean gloves and throw them away, and I'm going to perform hand hygiene. I would go ahead and document this procedure in the MAR and also document how the patient handled the procedure. And I would also document if I saw any allergic reactions as well. And then I would come back and assess the patient as indicated with the medication we administered. Thank you.